My name is MacSweeney. I'm a consultant vascular surgeon and I deal with diseases of arteries and veins. So an aneurysm is an enlargement of an artery, and it happens because of weakness in the wall of the artery. So the artery's got blood under pressure inside it, and if the wall's weak it can gradually stretch over time, a bit like blowing up a balloon.
I have known about the aneurysm that my father has for about 6 years. He has an aortic aneurysm in his abdomen, so basically the aortic valve that goes down into your abdomen.
As far as the discovery of aneurysms are concerned, one of the issues is that people often don't know they have an aneurysm until it causes trouble. And the main aneurysm that we're concerned with is one affecting the aorta in the belly, so that's the main artery taking blood from the heart to other places in the body, and the bit in the belly is the bit that takes blood down towards the legs and the lower half of the body. And often that, because it's quite far inside, it can reach a large size without anyone knowing that they've got one. The way they're discovered at the moment is mainly by chance. So somebody has a scan for some other reason and they find that well, they were scanning them for something else, but while they were scanning them they noticed they had an aneurysm.
The person we lost as a family to the aneurysm was my ex-husband, who's the father to my 3 children. He collapsed one afternoon, suddenly, totally unexpected, but due to the pain he was in, he was taken into the hospital. Very unlike Martin, because he didn't like hospitals, but was obviously in a lot of pain. So an ambulance was called, lots of tests were carried out. The doctors didn't know what was happening until they finally did a CT scan and discovered the aneurysm, in fact 2 aneurysms. By the time the aneurysm was discovered, however, it was too late, and the aneurysm very shortly after burst, which resulted in pretty much instant death. Martin died of an thoracic aortic aneurysm, which is in the thoracic part of your body, which is the chest. So the aneurysm, there was actually 2. One was at the top of the aorta and the other one was on one of the branches. And they were both in a situation where they were behind his major organs, so very difficult to access.
There are 4 types of aneurysms: abdominal aortic, located on the bottom portion of the aorta; thoracic aortic, found in the chest portion of the aorta; brain aneurysms that are located in the blood vessels on the brain; peripheral aneurysms are located on other arteries rather than the aorta and the brain. Aneurysms can grow very large without showing symptoms. 2 out of 3 people who suffer are male, and they are more common in older men.
There's a national screening programme coming along, so all men aged 65 now get an ultrasound scan of their aorta to see if they've got an aneurysm. So hopefully people finding out the first they know of their aneurysm occurring when it ruptures should be a thing of the past. How are they caused? What makes them happen? So the main risk factors are smoking. They're commoner in old age, they're commoner in men than women. They can be inherited tendency to make them. So all of those things come together. This is just a bit of a model of what it looks like. So this is what you might see if you'd opened up somebody's tummy and put the bowel out the way, and you find that the artery comes down here. This bit here where it swells up is the aneurysm, is the weakened bit where it's ballooned up. And these 2 branches here are the 2. The artery divides about the level of your tummy button into artery that takes blood to the left leg and the right leg. Okay, so that's what roughly sort of, I mean, it's obviously a rubber model, but it's roughly what an aneurysm looks like. And so what you need to do is to sew in or put a sleeve up the inside to line this weakened bulgy bit here, so that the blood goes from normal artery here into the bulgy into the new graft you put in normal arteries below. Okay, and this is an example of the type of graft we use for keyhole operations now. So you can see that this has got a bit here, and then it's got two limbs here which go into each leg. And what this thing does is you can squash it right down. It's got these metal springs inside it, but you can squash it right down, and you can get it inside a bendy tube like this. So this, what you would do is you pass a wire up the inside of the artery, up in, from the groin into the patient's artery in their chest, and then you'd slide this thing over the wire till it's in the position you want, using X-rays to check its position, and this would have the graft inside it, like that, folded up inside it. And then when you're in the right position, you pull this bit back. I don't know if you can see that. So basically it's held inside this dark grey sheath, and if you pull the sheath out and the graft stays where it is, then it will spring out. And so basically that's what you do, is you put the graft up inside, get it in the right place, pull the sheath back so the graft pops out. And I mean, it's slightly more complicated than that, in that there's another couple of legs that you need to put on to finish building it. But that has made a huge difference to people, because you can fix their aneurysm from inside rather than having to make a big cut in their belly. And we use these for the ruptured ones as well. In fact, we did the first one of these cases in the world in Nottingham a few years ago now.
The checkups are done every 6 months. Basically, he just has a scan, and that's how it's measured. That's how it's monitored. When it gets to a certain point where they need to start thinking about operations, then he'll go like once a week, just to keep having it checked, and then they'll decide whether he goes into hospital to have an operation. If he requires surgery, it will be as and when. So basically, if he requires surgery, they will just say, it needs to go now, you need to go in now, and they'll take him in. There won't be a set date, because obviously if it's stretched that far, it needs immediate action. It won't be you'll go in 4 weeks or whatever, it will be straight away.
We don't believe that we could have prevented this from happening. Martin was healthy, he never went to the doctors, particularly for routine tests. He was never felt ill, and so far as we know, research doesn't say that any particular lifestyle can affect you either getting an aneurysm or not getting an aneurysm. So we don't believe that anything could be done to prevent it, which is probably the hardest thing to handle.
So basically, if we're talking again about the aneurysms in the belly, the risk of them causing trouble depends on how big they are. So when they're small, they're actually very unlikely to cause any trouble, and in that situation we monitor them with ultrasound scans. So they have just a bit of jelly on the tummy and a quick scan, a bit like people have when they're pregnant, to keep an eye on the size of them. When they reach a certain size where the thought is that they might actually be at risk of rupturing, then we would normally fix them to prevent that happening. And the basic idea is that you take away the blood that's under pressure from the weakened bit of the artery wall. And you can do that in two ways. One is you can, the traditional way of doing it is make a cut in somebody's tummy and to sew in an artificial artery inside the aneurysm, so the blood goes from normal artery to artificial artery and back to normal. More recently, and we pioneered a lot of this in Nottingham, is to put a sleeve up the inside. So instead of having to make a big cut in the tummy, you can make smaller cuts and get to the artery in the groin, and then pass a sleeve up from below to seal off the aneurysm from inside.
Is there anything in particular that a patient has to do when they're recovering by themselves at home? Are there any restrictions?
No, I think again, clearly it depends whether you've got a big cut in your tummy or not. You're going to be more sore and take a bit longer to be, carrying suitcases or, carrying your shopping around if you've got a big cut in your tummy. If you've got a keyhole repair, really it's just a question of how comfortable you are. If you do it and it feels comfortable, you can do it.
My father is restricted from working. Obviously he was a manual labourer, he was a farmer. So he can no longer take on too much heavy physical work, so he doesn't work anymore. Basically he's had to retire. As for the family, there's always got to be someone around, really. So obviously my mum doesn't work, so she's with my dad most of the time, but we don't leave my dad on his own much at all now. He's always with someone.
How does an aneurysm affect your family and also me? In answer, I would say, how does any death, sudden death, affect a family? It's affected my family because my youngest son was only 16 at the time, and to have to deal with that at such a young age and at such an important time in his life is hard. His other sons were only 19 and 21, so they've got a lot of life to live and they're going to be living it without their dad. So it affects me because it affects my children, but only time will tell as the children get older. But at the moment it's a case of live your lives, don't let it affect you, and enjoy it, because that's what Dad would have wanted.
There are places to go and people to talk to about aneurysms. You can speak with the Circulation Foundation. They are a support group that are in place to deal with aortic aneurysms and other vascular diseases. You may also contact the Brain Aneurysm Foundation to deal with brain aneurysms and strokes. If you would like to be tested, speak to your GP about it. If you have any worries, you may be referred for a CT scan. Very little symptoms are shown, so if you have any worries or it runs in the family, be safe and get checked.